What is the revised R-IPI for lymphoma? Imagine trying to predict how well someone with a serious illness might do over time. That's what the revised International Prognostic Index, or R-IPI, helps doctors do for patients with a common type of aggressive non-Hodgkin lymphoma called diffuse large B-cell lymphoma. This tool was created to give a clearer picture of prognosis now that modern treatments like R-CHOP, which combines rituximab with chemotherapy, have become standard. These treatments have improved survival rates, so the old methods needed updating. The original International Prognostic Index looked at 5 main factors: whether the patient was over 60, if the disease was at an advanced stage like stage 3 or 4, if there was high serum lactate dehydrogenase or LDH, how well the patient was functioning based on performance status, and if the cancer had spread to more than one extranodal site outside the lymph nodes. Each of these factors added a point to the score, and the total score divided patients into 4 risk groups, from low to high risk. However, with the advent of newer treatments, the survival outlook has changed. The R-IPI simplified this system by regrouping the same 5 factors into just 3 risk categories. Instead of 4, these 3 groups better reflected current outcomes. Patients with no adverse factors are considered very good risk, and they tend to have about a 94% chance of staying free of disease progression and surviving for years after treatment. Those with 1 or 2 adverse factors fall into the good risk group, with around 80% of patients remaining progression-free and nearly 79% surviving for years. Patients with 3 or more adverse factors are classified as poor risk, with about a 53% chance of progression-free survival and 55% of overall survival at 4 years. This update is important because it aligns prognosis more closely with what we see today in patients treated with modern immunochemotherapy. It also helps doctors make better decisions about treatment plans and helps in designing clinical trials. The R-IPI does not replace clinical judgment but serves as a practical tool to estimate outcomes more accurately in the current era. In essence, the R-IPI uses the same 5 clinical factors as the original but reorganizes them into 3 groups, making it easier to predict how patients with diffuse large B-cell lymphoma might do after treatment. It emphasizes the importance of individual risk factors and helps guide personalized treatment strategies. Always remember, each patient is unique, so it's essential to discuss prognosis and treatment options with a healthcare professional who can interpret these tools in the context of your specific situation.